Good evening and welcome to Gibson's Bookstore Remote. I'm Elizabeth from Gibson's Bookstore, and I'm very pleased to welcome you here this evening as we present a new book out this just 9 days ago, I think you said, Charles. The book is Germs at Bay, Politics, Public Health, and American Quarantine. We are joined this evening by the author, Charles Vidich. Charles is the author of Germs at Bay. He is a consultant and advisor on public health and bioterrorism issues and was appointed a visiting science at the Harvard School of Public Health, working for 10 years on national quarantine policy. He has numerous publications on occupational and environmental health and served as incident commander for the U.S. Postal Service's National Anthrax Response in 2001 and 2002. He holds SM and MCP degrees from Harvard and has received numerous White House, EPA, and Postal Service awards for his environmental and anthrax response work. He serves on the Connecticut Council for Environmental Quality, appointed by the Speaker of the House. Germs at Bay is available from Gibson's Bookstore. We are pleased to offer in-store browsing, curbside pickup, and shipping right now. He is joined in conversation by Elizabeth Howard. Elizabeth Howard is an author, journalist, and creative director. Her books include Queen Anne's Lace and Wild Blackberry Pie, A Day with Bonefish Joe, Ned O'Gorman, A Glance Back, and the books, Ned O'Gorman Artist Books. She is the writer-in-residence for the Randall's Highland Park Alliance in New York City and a columnist for New Hampshire's own Laconia Daily Sun. Thank you to the two of you for joining us this evening. To our audience, if you have questions throughout this event, please do feel free to type them into the chat sidebar or the Q&A function. We will be answering questions at the end of the event, so don't panic if we don't leap on your question right away. To the two of you, Charles, Elizabeth, thank you so much for joining us this evening.
Well, thank you.
Please start our conversation. Take it away.
Yeah.
Okay. Let me just get this view right here. Elizabeth, thank you. I'm sorry that we're not at Gibson's Bookstore, and I always want to shout out for independent bookstores. We need to support all of them. So thank you, and perhaps by the summer we'll be able to gather together. Charles, it's lovely to be here with you in conversation around Germs at Bay. And
You're breaking up a little bit there, Elizabeth.
I think you moved your microphone.
Yeah, you're breaking up a little bit.
I didn't.
Much better, much better.
Yeah.
Okay.
There we go.
Thank you. So to be able to look at quarantine through your lens, Charles, you know, quarantine being one of the most primitive and universal instruments of defense against contagious disease epidemics. You write in the acknowledgements that you spent 18 years working on this book. So that would mean you'd started in about 2003. But you've also told me that when you were in the 4th grade, you went into the school library and read everything you could find on the American Revolution because you wanted to write a book. So I think we can trace the genesis of some of the ideas in this book back beyond 2003. So I thought perhaps an entry point into your work, and it's just a wonderful book. And I'm sorry that it wasn't out last year, actually, so everyone could read and benefit from it. Is that you tell us a little bit about your research and the process. And of course, I have to ask you if you ever thought that you would be publishing this book in the middle of a global pandemic.
Well, not initially, no. I thought it would occur in just normal times, but in fact, when it did occur this last year, we were on our way down to South Carolina, and I had some inkling that the COVID-19, even before it was named as such, might be a time to dust off my manuscript and get it into its final form. And lo and behold, of course, I ended up with my wife spending about 3 months in South Carolina on what I call an undisclosed island for purposes of this conversation, where I finished off what I had to do to get it ready for publication. And the process from right there was remarkably fast. It could have been out a lot earlier, but we jointly decided, Prager and myself, that it wasn't worth rushing it to get it out the first day COVID hit, but to give a little bit more maturity to the topic by being able to address some of the things about COVID-19 within the context of American quarantine history. But if I may go back a little bit on your question of how it all evolved, yeah, I would say in fourth grade, I started thinking about this subject. I devoured every book in the fourth grade library, and there wasn't a lot there. And so I put it off for about 50 years. And it really only in hindsight did I realize that one of the most important chapters from my point of view was my whole reassessment of the American Revolution in the book Germs at Bay. And I came to understand that it came from my fascination with the American Revolution. And as a result of that interest, a whole set of insights about American history and the American Revolution came out that have never been understood before. But specifically in the more recent time is really my involvement in the anthrax response in 2001 and 2002 that led to this, where I saw the abuses and misunderstandings of what quarantine was about. And one thing led to another, and I was working for the Postal Service in various capacities, not to mention the incident commander role for the national response. And lo and behold, after making many presentations, both public and private, one of them was to Harvard professors, and one thing led to another. And before I knew it, I ended up going to Harvard for graduate work in public health, which led to 10 years of work in the area of quarantine. So it was remarkable how it all happened through a series of chance events. At a CDC conference in the middle of the pandemic or epidemic of anthrax, I ran into somebody named Don Milton, who is really one of the formative people in the whole area of aerosol biology and its impact on disease transmission. And that fortuitous dinner one night after a CDC conference with a friend of mine named John Friedis led to a series of connections that eventually led to this whole process of writing the book.
Listen, my children, and you shall hear of the midnight ride of Paul Revere. On the 18th of April in 75, hardly a man is now alive who remembers that famous day and year. I think all school children, I don't know about now, but certainly when I was at school, know that Longfellow poem and have this image in our minds of Paul Revere galloping on the horse with the cape, flowing in his back. But you give us a very different portrait in the book of Paul Revere as the public health official. So perhaps you can enlighten us.
Well, to me, that's one of the great stories of American public health. In fact, there is an award, I think, that Harvard gives to public health leaders called the Paul Revere Award, but yet no one has really talked about what he did. I call him the White Knight of quarantine because in the space of 2 to 3 years, he did more to revolutionize the use of quarantine in America than any other single individual in previous American history. What he did was masterful. We had at the time a period in which yellow fever was the raging disease at the time and had a major impact on really the whole concept of states' rights versus federal preeminence in decision making. As a result of the fact that nobody knew what the disease yellow fever, how it was caused. Some people thought it was caused by putrescible waste and foul swamp gas, and others thought it was a contagious disease. Well, the masterful thing that Paul Revere did was, rather than doing what Solomon did, which was to split the baby and create anguish, he took the opposite approach. He took the big tent approach, and he said, if we assume that it's a contagious disease, we'll apply quarantine in the most effective way possible. If we assume it is a disease of sanitation, we're going to clean up our act in Boston like no other time we've done before. And indeed, that's what he did. And he was able to do that in a way that was remarkable, because he was a man who was not only a craftsman, he was a businessman, and he was an icon of his time. He had the charisma to pull it together and do what no other 19th century official had done in terms of making quarantine work and to get people to buy into it, because nobody likes quarantine. So with Paul Revere, he sweetened it.
So, quarantine, which as a noun is a place of isolation and physical separation. As a verb, it's to impose isolation. And of course, we think of those three major port cities, Boston, New York, and Baltimore, as where shipping was coming in. And so that's where you had a lot of the quarantining. Perhaps you can talk about where that, how they managed that.
Well, it was not only those three, but Philadelphia as well. In fact, I emphasize the what I call the tale of two cities, is comparing the history of quarantine use in Philadelphia. Even though it's not on a ocean, it's upriver from the East Coast. It still was really a significant city for quarantine, only because it was after Boston, which was the largest port city of the 17th and 18th century. In the emerging 19th century, it was Philadelphia. And then later, of course, it was New York. Those are the four cities that where quarantine was most significant, because that's where the migration occurred. That's where all the trade in America occurred. And so trade and disease go hand in hand. That's one of the first things that we find: trade and disease, and of course, migration and disease. And as a result, though, the interesting thing was Boston was really the one that led the way, the leadership in terms of public health, Massachusetts in general, Boston in particular, largely because of the history of the city of Boston. Boston and Massachusetts Bay were distinctly different colonies than down in Pennsylvania or New York. Of course, New York was a Dutch location in the 17th century for part of the time. And so as a result, because Boston was actually had a charter which gave them at least a quasi sense of independence, they acted as if they were completely a different country from United Kingdom or England. And that, as a result, meant that they were all too eager to apply quarantine, despite what the King's Privy Council had to say. Whereas in the other colonies, they were directly under the thumb of the King and the Privy Council. That was the Privy Council was really like the foreign minister function of English government. So they all had quarantine functions, but to a large extent, a lot of what happened was copycatting what happened in Boston through the other cities. But there was a distinction too, though. Philadelphia took an entirely different approach to quarantine. Their philosophy was not to quarantine people on islands, even though they had quarantine islands. Their legislative history was to focus on trying to clean up the ships that came across from Europe to this country, because those are the ships that basically were festering grounds for disease, because people were coming across in extremely crowded vessels. And a lot of the people who came to America in the 17th, 18th, and 19th century never made it here. They just did not make it. And so, but that was not the Boston approach. Boston just said, put up a wall, you're gonna stay on that island until you either live or die. But in Pennsylvania, it was somewhat more humanitarian in terms of the strategy. But it was also a much more autocratic strategy. Boston has historically had a much more democratic process in terms of how it handled things. It's just one of the reasons why quarantine always has worked better in the Massachusetts experience than some of the other colonies, because it had a much more participatory form of government.
So tell us about some of these islands where they quarantined.
Well, I haven't put them all in my book, but there were 66 islands across the entire eastern seaboard and the Gulf Coast throughout the early colonial and post-colonial period. Although in the case of what I focused on in the book, because there is a rich history, the islands that had the most significance really were Castle Island, which was really the de facto quarantine island in the early 1600s, which lasted really up to 1717 when they created Spectacle Island in Boston Harbor. It was called a Spectacle Island because it low tide, it had two islands that looked like spectacles. And so they put that island as the quarantine location. Half the island was owned by a guy named Mr. Bill, who is a butcher who decided he could make some money selling the land for a quarantine operation. And the other half, of course, then became the quarantine center. And that lasted for a goodly number of years. And then Rainsford Island was the next island that was adopted as a quarantine island in Boston. Rainsford Island is the one that probably has had, had the longest history in the 18th century after Spectacle Island, followed by, after that came the Gallops Island in 1867. And there was a period too, right in between Deer Island, where that island was used in Boston as a multi-center concentration camp for the poor, the disaffected, the psychiatric cases, the criminals, and the immigrants coming in from Boston. There was nothing else in American history quite like this, where because Boston was facing extreme cost overruns in terms of all of the development and infrastructure that they're trying to put into the cities during the 19th century, that anywhere they could cut costs, they did. A little bit what's going on now with local governments that are really facing extreme financial pressures. So that was one of the most unusual combinations of quarantine with other confinement principles, all on the same island. It's almost a recipe for disaster, which it was. As a matter of fact, one of the worst recipes for disaster in American history, which I go into it in this book. And one of the legacies of that is the legacy that the Irish still have of that experience of coming into America and being treated the way they were. It was a terrible experience.
When I was preparing for this, I called the New Hampshire Historical Society because I thought, with all the number of mills in New Hampshire, people working in close quarters, unable to social distance. And I wondered what effect the Spanish flu, and of course we know that the Spanish flu didn't start in Spain, but anyway, that's another story. And so I thought I would gather some information about that. And I spoke to the archivist. She was a lovely woman. And she said, I'll get back to you at the end of the day. And I thought, I would be given this list of books and journals and things to read. And the end of the day, she called and said, well, I really don't have anything here. There aren't any books. And what I recommend is that you go to the local newspapers and the local libraries and see what they have in their archives. So clearly, Charles, there's been, what's happened and why haven't we had in the United States more literature about public health?
Well, there's literature on public health, but there's not so much literature about quarantine and public health. And there are a couple of good reasons for that. One of them is that it's not exactly the subject that everybody wants to read about unless you're in the middle of a pandemic like we are right now. So timing is everything from the point of view of attention span and attention interest in a subject. The other part of it is that there's an enormous dearth of information. In order for me to do this book, I had to go through some 50,000 documents, of which I still have on my computer or in the back of my office here. I have hundreds of 3-ring binders of what I had to collect, and it's all primary source information. I literally had to go through every single paper from 1701 to 1800, every single paper, not only every single paper, but every edition of those papers. And I'm not talking one paper. There were dozens of papers that existed. In fact, Boston was one of the most literary cities in all of the United States in that colonial period. They had 4 or 5 papers at some periods in time. In order to pull together the history of what happened, some of this meant going through and pulling this together. Literally, I spent years pulling that data together. I have an enormous amount of data that it took to write some sentences, some paragraphs took months, if not years, in order to get those statements to be precise and accurate. So that explains why so little has been written, because there has been so little that has been documented and put together. Secondary sources are the easy way to write a book. Anybody can do that. The primary level is an arduous effort, and that's what took 18 years.
So we are in New Hampshire at Gibson's. So there is some research on quarantine in New Hampshire on some of the islands that you didn't put in your book, but perhaps you can share with.
Sure. I mean, it turns out there's 3 islands out of those 66 I mentioned earlier that in colonial, post-colonial period: Shapley Island, Clark Island, and Anthony Island, all in the Portsmouth harbor area, which were significant and important in the early Portsmouth history, because Portsmouth was another point of arrival for immigrants and for trade. It wasn't as popular, obviously, as Boston, but that was an important part of it. And you know, there were other connections to New Hampshire. I mean, if you'd like, I can mention about from the Spanish flu. A lot of people do not know. You know, we've heard about experimentation with the syphilis that the CDC, which is one of the black eyes that CDC, U.S. Public Health Service, had with experimentation on population of African Americans in the South. But what people don't know was that Rupert Blue, the Surgeon General, who was the Surgeon General during the Spanish flu pandemic, arranged to have experimentation on volunteer Navy enlisted men from Bumpkins Island, who happened to be, that's nearby, another island, Boston Harbor, of which there were about 30. And they were so-called volunteer. They were actually in the brig, and they were given dispensation if they're willing to so-called volunteer to be exposed to Spanish flu. Well, 60 of them were put into this experiment. The first experiment didn't work, except perhaps by oddity, in that the surgeon who was responsible for managing it directly on the island died from Spanish flu, and they stopped the experiment. But Rupert Blue was not content to let that be the end of it. So instead, he said he found out that the Portsmouth Naval Yard, there were 50 infected. Hold on 1 second here. We have that little noise on my phone. There were 50 infected naval enlisted men in the Portsmouth Naval Yard, and they decided, Rupert Blue gave the okay to send up a number of the healthy Navy enlisted men from Gallup's Island, who were under this so-called volunteer program, and infect them. And they infected them as many which ways they could, by ingestion, by inhalation, by other mucous membranes. They tried everything they could. And believe it or not, none of them got infected, not a single one. And so Rupert Blue, after all of the effort that the Public Health Service tried to do to figure out the cause and transmission of Spanish flu, ended up empty-handed as a result of this effort. And that was Portsmouth's contribution to national public understanding of disease transmission, and also really today a black eye on the Public Health Service. And I will tell you, from my archival days at the National Archives and Record Administration in Maryland, they've actually purged the records of all of this so that nobody knows what goes on. But fortunately, Harvard has kept one of the original documents that laid the whole story out. Thank God that archivists catch things, because not everybody considers something top secret until later on. So that's partly what's in the book, to let that story be told.
So you use the term basic reproductive number to describe the communicability of disease. And what does this mean, and how is that relevant to stopping an epidemic?
Well, the whole idea of a basic reproductive number is that depending upon what disease we're talking about, some diseases move very quickly. The most communicable disease that we know is measles. For every person who gets infected, as many as 14 to 18 people can get it from that original index case, the first case. And, with COVID-19, we're talking, depending upon, we're in the midst of it, so no one can really give the right answer. Preliminary numbers, 2.5, 3.5, 4.5 people get infected for each person index case. And then you do multiplication. This is a little bit like a bank account where you have it in a high interest rate account. The higher the interest, the quicker your money appreciates. Well, the higher the basic reproductive number, the quicker that disease actually proliferates and spreads. But it's important to understand that what that is about is not, despite the apparent quantitative nature of it, really a fixed number. It's a function of the culture and of the crowdedness and of the sociability and networks that which people or any animal that transmits disease has. So if you live in a society which is extremely rural and people are 10 miles apart, the whole idea of communicability is entirely different than if you're in the urban jungle of any American or overseas metro center. And so it's all about the contacts and how quickly people are in touch with others. And one thing to understand, aside from the cultural side of it, people use that basic reproductive number as if in a naive population that's never been exposed, this is what would happen. But of course, that assumes that all cultures have the same densities, the same networks, and all of that. So the basic reproductive number is also influenced by wearing masks, hand washing, and all of the public hygiene methods that we apply to a disease. So that number is a completely, as I call it, it's a wonderful number to scare the bejeebies out of people. And it's only useful later on in retrospect for those who want to write the history of these diseases. But it's really almost irrelevant other than to scare the bejeebies out of people in the beginning of an epidemic.
So do we still have a lot to learn about how diseases are transmitted?
Absolutely. This is the continuing crisis of our society. And we are under the illusion that we understand how diseases are transmitted. And of course, it's an evolving thing. For those who've ever read The Structure of Scientific Revolutions by Robert Kuhn, the whole idea, there is no final answer in science. It's a continuing evolution, not only because we learn, but the bacteria and the viruses that we deal with are ever mutating, ever changing. What may be a highly virulent case of smallpox at one epidemic in the early 1600s might have been a very innocuous one in the early 1900s. So there are a whole range of issues. One example of one of these is that for the entire 19th century, consumption, which is now called tuberculosis, was not considered a communicable disease in America. And then after we had greater contact with European scientists who were ahead of us, within a space of 15 to 20 years, the entire country, all 50 states, went from considering it non-contagious to making it contagious, and it became a revolution in public health. Well, we're still finding these same issues with the human papilloma virus today. And there's a variety of other things that have been found to be caused by viral transmission that people never thought were viral in nature. There's a lot of things that still remain, even with diseases with the COVID-19. We have a basic understanding that it's aerosol based. But when we started out, there was an overemphasis on hand washing. Well, yes, hand washing is important, but if 90% of the danger, which is all aerosol based inhalation danger, is the real issue, let's remember to put our priorities on inhalation. Not that hand washing isn't important, but there was no face mask focus in this society. And yet we've known it. We've known this not only from the anthrax days from 2001, but we've known it from 1918. So there's a lot of things that represent just relearning what we've known, and other things are learning things for the first time.
Well, of course, it's always, when we look back historically, it's always, history that explains the present. And you suggest that what we need really is kind of a triage of skills, resources, and public support, supplemented with transparency in government and public trust. So what are the leadership skills that you think are needed now for our government leaders and public health officials to help us through a pandemic like the one we're in?
Well, I think Paul Revere is probably one of the best examples in American history. Although I will say that when it came down to the 1872 smallpox epidemic in Boston, where I think they screwed up royally during the first 12 months of the event, when professional public health people are brought into the process and given responsibility for managing the event, and where the political figures are there to provide the fiscal resources and the support, we have the ideal situation. But where decisions are being made by political figures without consideration or dismissing the public health consequences, or delaying them because of concerns about the economic concerns, we end up with some of the things that we found here today in our society. It's actually deja vu all over again, as Yogi Berra used to say, because these things, if you go back in the history of American experience with quarantine, have happened time and again. So there's a balance. There's a balance between giving public health officials too much control without thinking of the economic consequences. And the opposite is also true. And so there's a delicate balance in doing it. There's never been a case in which we have not had a battle between the forces of salvation, saving one's lives or the lives of our community, and saving the economic integrity of our community. This has never been a case where this has not been a challenge between the two forces. But some places it has been done better than others. And I'd say one of the best examples, again, would be Paul Revere, and also probably the 1764 smallpox epidemic in Boston, where there was a collaborative approach between the public health people, the physicians, the business leaders, and the politicians. And this was the first time in American history when they had smallpox parties for inoculation, where it was the most feared disease in the world, became an opportunity to establish what is called inoculation. It had happened in many years earlier, but it was the first time in American history where people accepted this and actually looked forward to a potential disease that would kill maybe 1 out of 100 rather than kill 30 out of 100. And it's remarkable that it happened because people came together. and did it in a collaborative fashion. And that's one of the most important things about trust, transparency, and triage. It's having a public input process where it's not rammed down the throats of the public. It means there has to be a process. And that's one of the lessons that we're going to have to learn. And CDC, of course, is going to be the hardest one to pull into it because they're at the highest level of our bureaucracy.
So we found some mob violence and riotous behavior associated with epidemics, in American history. And is there a connection with quarantine, or can you talk about that a little bit?
Well, it's not a coincidence that many of the epidemics in American history have been associated with tar and feathering the stigmatized, those who might have had smallpox or potentially were thought to have it, or those who lived too close to a smallpox hospital, or those who rebelled against wearing face masks like we are today, or those who rebelled against quarantine of their neighborhoods. The overwhelming majority of cases tended to be that way in American history. And I go through a number of them in the book, but there are also examples of where it was done right. The 1764 smallpox epidemic was an example of that. Cases where there was trust, transparency, and the principle of triage, where we put through a collective understanding process of what needs to be done first, given the limited resources. So there are ways of overcoming these things, but when the public is shafted and not allowed to have a part in the process, what happened in 1872, 5,000 people in South Boston rebelled against what happened with the smallpox hospital. For those who don't know, most of the 19th century people recognized smallpox hospitals as not a place that was a good thing, but as a place that were super spreaders of disease, because everyone who had smallpox went to those hospitals, and therefore they were the conduit for disease. And it wasn't a coincidence. These were actually, my own studies have shown that the worst cases in Boston in 1872 were tenement houses and along the ways to the Boston smallpox hospital that was for a while in downtown Boston. Of course, because of those riots, all of these smallpox infected people were forced to go out to the islands. So that was not such a good thing. But to get your point, violence has been, and even as you know today, the COVID-19, we've seen some of the same things. And the question is how to do it with trust with the public and with a transparent process. That's not easy, because it's a little bit like what I once mentioned to you about the idea. Here I am, about 72 years old. If I started picking up the violin at my age, you know what it would sound like. Well, that's about what happens to American experience with managing quarantine. They have about as much experience with the violin as I do.
Well, I think we have some questions, but I just want to ask you one more question, Charles, and that is, I know in the early 19th century, the US Public Health Service kind of revolutionized medical inspections by sending doctors to US embassies around the world. And then, and so anyone who wanted to, immigrate to the United States had to go through a medical exam, which changed, what was happening here. So what would the implications be for something like that today, given all the issues we have around immigration?
Well, I think that was probably the most revolutionary thing American government did in the late 19th century, all the way up through to the period prior to World War II. Because what we ended up, we relied up in the, for the last 300 and some years on the islands of our nation as the quarantine spots where people stayed until they either died or they came into our country. And after a while, Congress came to the realization, we got to do something different here. This is just a broken, system. And not that the Europeans liked this so much, but after a number of years, going from about 1890s all the way up to 1920s, we finally got 38 nations in which we had our own public health people to medically inspect immigrants before they came to this country. What was revolutionary was not only that, because you then didn't need the quarantine islands anymore. You could, as a say, it's the last stop. You could always see if something happened in between the last inspection when they came to America. But it also filled into European nations the responsibility to get their act together on public health and the health of their own people. But one other thing that was connected to that, which is something called radiopractique. What happened as we became more sophisticated, vessels that came to America were held to a higher standard. And they were going to be clean to standards that were never thought possible in previous years. In fact, some of the fumigation techniques that were used, including Zyklon B, which is one of the most powerful fumigants that exists in this world. It was the same fumigant that was used by the Nazis in World War II for the annihilation of the Jews. And that's how powerful the sanitation systems that were used. And so what happened was when they put physicians, it was a requirement to put physicians on vessels coming to America. When they did that and the physician could radio into the port that they actually had cleaned the boat, there was nobody sick, they had done the deratting, there was no rats on board, and they were able to do that 24 hours before arrival, they could then self-quarantine themselves or self-sanitize themselves. And that eliminated the entire quarantine system that America had. As a result, we dropped all of our defenses as a nation. And really from 1945 onward, quarantine was dropped as is a completely irrelevant concept. And yet, of course, today, now we're coming back to the need to revisit the very principles again of what we had become masters of in the world. We were the best. And now we have to catch up after a lagging last year.
Elizabeth, are there some questions?
We do have some questions. Let me read some of these off for you. Charles, do you see COVID-19 as similar to flu in that we will need annual variants in the inoculation to cope with the annual mutations?
Well, that's a 2024 foresight question as a hindsight question. Based on what the flu is annually, we have a new flu vaccine each year. It's never the same. So in principle, there's no telling how effective the vaccines that have come out by Pfizer, Moderna will be, or Johnson & Johnson will be with the variants that emerge. No one will know because the variants could go either way. It could become more lethal. It could become more contagious. More contagious is not as critical as more lethal. But if it's more lethal and more contagious and the vaccines don't work, it could certainly be an issue. And there's no question, this is one of the reasons why the idea of having what the smallpox eradication program was about, which is a combination of ring quarantine with vaccination at the same time, where you hold an entire city in quarantine for 14 days while everyone gets inoculated or vaccinated, as it's called today, and you completely establish an immunity system. And that's actually the only disease in the world that's ever been eradicated, and it was using that principle. I believe that's one of the strategies the Biden administration, if they had enough vaccine, should be thinking about, because that is the only thing that's ever worked in that regard. And it remains to be seen how effective, but even if they don't completely stop infection, if they do stop and reduce mortality, that will be useful. And so we may be chasing a variant as we go, and we may be having to make variant vaccines as well.
Right. Someone asks, in the mid 1900s, people were required to stay home for, say, measles or polio with no outside contact. Signs on the doors and windows indicated no contact quarantine. In today's COVID outbreak, are we really in quarantine with people out and about everywhere?
Well, no, but I will say this. Uh, the last chapter of my book goes into the need to completely revolutionize all the definitions of what quarantine is. And I go into a fourfold concept of what quarantine needs to be considered. Uh, and I've really called on the American Public Health Association to start rethinking the entire concept, because what we're doing is not quarantine. What it is, what I call self-tethering. And in fact, I'd say the tether is a very long one. In fact, the dog may have actually gotten off the tether in a lot of places. It's the most loose. In fact, because of the way we're doing it here, there's nothing wrong with self-tethering, by the way, because one of the most important things to understand is in early America, we're talking in village life. Villages were all very unique and very small. Villages were close and confined. Today, we're dealing with a megalopolis environment where we're so highly interconnected. The networks are national and international in a way that we've never seen before. And we do not have the government resources to do it at this point. Now, the Chinese seem to have pulled it off. Of course, they're not a democratic society, so to do things in that way is a different thing. But in a democratic society, when you also have a Congress that is divided, to get the resources, the massive resources to do it, is just not it's a non-starter. The only thing that's really going to work is raise your right hand, folks, and follow certain principles of public hygiene and looking out for your fellow man and woman and children, and recognize that what we do affects everybody. The weakest link in our society right now are those people living in overseas nations that have diseases that come back to bite us. We're only as good in this world as the weakest point in the entire system. There is no isolationism here. Diseases travel fast as our networks. It used to be they only traveled as fast as the vessels, 6 weeks across the Atlantic Ocean in the 1700s. Then it went down to 2 weeks, then to 1 week. And then, of course, now 8 hours, you can go to Australia in 20. And all of those have completely, it's put the emphasis on self-tethering as far as the American approach goes. If the Chinese are going to perhaps pay for some of our costs here, well, that might be a different story.
But let me just interject. Do you think that it will ever be possible, possibly through something like WHO, to develop a multinational like epidemic response team, so that where people are collecting the information, and so they're able to stop these situations when they start?
Well, there is an enormous amount of effort being put into that very concept. And the only thing that's stopping us is that Big Daddy here, that being God Almighty. In other words, there's nobody on top of all the 193 nations that are part of the World Health Organization to say, look, ladies and gentlemen, you're all going to follow the following rules. So the key here is we're still dealing with the same sanitary conventions of the early 1900s, where everyone has to agree to these things. But in the interest of survival, especially if pandemics get worse, because this is actually not a very significant pandemic from the point of lethality, 1% of the population versus smallpox used to be 30% of the population. So the key right now is the World Health Organization is going to have to revamp. It's what I call the rapid response team concept, where we bring in teams of the best across all the nations of the world, and who are pre-selected and are all on standby 24/7, whatever the team has to be, and on a rotating basis to be able to go in there. And even before that, we have what are now, there's the Epidemic Intelligence Service that the CDC was many years ago. really the experts on. We not only need the Epidemic Intelligence Service on an international scale, but we need the disease detectives who are right now romping through the jungles of the world looking for these novel pathogens ahead of time to let us know, and to be able to put up our defenses before they grab us by the whatever they may grab us by.
We have an audience question that asks, do you see a contradiction between quarantine and civil rights in that quarantine requires a suspension of travel rights and assembly?
Well, there obviously is a conflict, but the bigger question is, what is the public good? And the public good does not always represent individual rights. It represents the collective good. It represents understanding that if one person is potentially a person who could be infecting others, that person is going to have to be put under some kind of isolation or quarantine or self-tethering until we know for sure that they're not the cause of the disease. Because there are people who think they're that either they've been exposed but do not yet realize that they're going to get the symptoms, or they could be asymptomatic and still communicate the disease. And in the interest of the survival of our communities, our cities, our nations, our world, we have to think for the short-term pain of going through some of this nonsense to recognize what the positive consequences are for those who are really affected. 50,000 people died in nursing homes in the first 3 months of the COVID-19. And that was because of the failure to recognize how disease gets transmitted. So yes, there is a conflict, but one trumps the other. Survival and the community benefits are there. So how does that happen? It happens through understandings, through communication, through recognizing that we have to all share in the common good and the common pain to make it work effectively.
So I had a question for Butch, you might have already answered. Has there ever been a plague where we did well against it in terms of containment? And it sounds to me like the 1764 smallpox is what you keep coming back to. Why did we do quite so well there?
Well, that was a case of collaboration, a case where the physicians of Boston and even the people of New Hampshire in New England all got together and recognized that they could work together. And people from all over New England, Rhode Island, Connecticut, Massachusetts, New Hampshire, all came into Boston with the approval for a short period of time to get the inoculation and go through the what were called, really, some people called inoculation parties, 12 people together in a big house, and they all stayed together for the period of their incubation. And this was remarkable. It was supported by John Hancock, who many of you know, who was a signer. His famous signature, John Hancock, was involved with that period of time. But it was also the first selectman of Boston played an enormous role in this process, in making it happen, as well as the people at the town meetings. The people voted and said, yes, we want to do this. That's remarkable. Did you see anything in COVID-19 where everybody voted individually to make things happen? No, this was not that way. This was a ram it down your throat approach. That's not what happened in 1764. That was a case where people collaboratively put it together. And they also decided this is enough is enough. We got enough people coming from New Hampshire coming into Boston now. We're stopping the gates at this point. So that is what made the difference. It had to do with the transparency and trust that was connected with that event. It was a unique event in American history.
Well, there's a quote here in the chat sidebar from an audience participant who reminds us that those who do not learn history are doomed to repeat it. So we're about at the end of our event now. Elizabeth, I believe you had a quote that you wanted to read to close out our event. I'll start by saying thank you to everybody who joined us this evening, joining us from home. Thank you to Charles. Thank you to Elizabeth. Please share this quote with us. Tell us what it's about.
Well, I always think that when I'm talking with an author and a writer, that I like to read from their work. So I wanted to read something from your book. We now find the most lethal diseases emerging from ecosystem disruptions where humans have adversely impacted other forms of life. Coming into contact with novel species, they are indeed biting us back, whether it is for survival or convenience. In the last resort, quarantine is not a solution to the next pandemic, but a symptom of the ecological imbalances we have created that leave our species more vulnerable to pestilence than it ever has been before. And I would like to say, Charles, that I would love to have you and Dr. Fauci in conversation to hear. I think the two of you looking at where we are in the middle of this and with all of your background, that would be an absolutely fascinating conversation.
Oh, I'd welcome the opportunity to talk to Tony Fauci. He's involved with the 2001 anthrax response, so I'm quite aware of his broad range of knowledge and his importance to the American public health movement.
Anyway, thank you. It was lovely. And thank you, Elizabeth. As I say, I love Gibson's Bookstore. So
thank you very much for joining us this evening. To those of you joining us at home, the book is available from Gibson's Bookstore. Stay safe, everybody. Have a great night.
Thank you.
Thank you. Really appreciate the opportunity.
Bye.